Today in this lecture, we will briefly talk about threshold for osmolar stimulus of drinking. What is the threshold for drinking, or the point at which a person starts drinking water? Now, we have discussed so many times that when the human body is losing water, initially with the little loss of water, there is activation of antidiuretic hormone, there is a release of antidiuretic hormone, and it stops the loss of water from the kidneys. And then there is the stimulation of thirst center, due to which the drinking pattern, the person starts drinking water. But what is the exact point, or what is the change in the plasma concentration at which the drinking starts, or which is known as the threshold for drinking, or the threshold for osmolar stimulus of drinking? Now, we know that antidiuretic hormone may be released when there is increase in plasma osmolarity, or when there is an increase in plasma concentration of the sodium. And antidiuretic hormone may stop reabsorption of water from the kidneys, but it does not mean that there is no waste in the body and there is no waste material which the body should get rid of. So to get rid of the waste material in the body, there must be some outflow of urine, a little bit outflow of some concentrated urine, because even despite of dehydration, the body cannot compromise on the waste material which the kidney is removing. So whenever there is a change in the concentration of plasma, or whenever there is a change in plasma sodium concentration, it leads to drinking. It activates the thirst center in the brain, and the person starts drinking. So it has been seen that even with a 2 milli equivalent change, 2 milli equivalent per mole, 2 milli equivalent per liter, 2 milli equivalent per liter change in the concentration of plasma sodium, even this change can lead to drinking of water. Even this change can cause thirst. Even this change can activate the thirst center in the brain. And this is known as the threshold for osmolar stimulation of drinking, or threshold for drinking.